OCD can often impact one's work environment, especially if it takes longer for them to complete their work because they might be obsessing about something or distracted by an intrusive thought. They may have difficulty concentrating on getting their work done that day. They might find themselves avoiding certain tasks because it's getting in the way of them figuring out their thought or getting to the bottom of their thought. So, getting work done can take 2-3 times what it would take that same individual when they're not experiencing a spike pattern or intrusive thought. Other things, they may avoid certain experiences at work, whether if they're having harm thoughts about a coworker, they may avoid that coworker or avoid contact with that coworker, or worry about how they're portraying themselves to that person. They may avoid certain conference rooms or bathrooms because of fears of contamination. So OCD can impact on many levels the workplace, everything from getting your work done to meeting with your boss to worrying about getting fired because you had a typo in a piece of work that you did. So it can really impact many different sides of it. So one of the biggest misconceptions of OCD is that you have to be a neat freak, or that you have to have things organized, or that you're a germaphobe. And most people, or many people who have OCD, that's not the predominant symptom. They're often suffering in silence with intrusive thoughts or different forms of OCD that are lesser known, like Puro, in a way where they're not locking and unlocking doors. They're really experiencing more troubling thoughts. So the biggest misconception is that you would know that you met somebody with OCD. Another big misconception with OCD is that it's easily recognizable. Many people experience OCD and suffer the symptoms silently, and they keep their OCD in secret. They don't disclose to coworkers, they don't disclose to family members how much they're suffering in private, and they're able to maintain high-functioning normal lives, but that they're suffering with this secret that is very challenging. I find that most people with OCD are high-functioning and intelligent, that it takes a quite deal of amount of thinking and planning to be able to have intrusive thoughts. It's almost that the brain is working, especially with some of the ROCD or POCD, the brain is working with higher moral standards. So there's overthinking, there's overanalyzing. So many sufferers of OCD are highly intelligent individuals, highly functional, doctors, lawyers, writers, very reputable people in society that you would never expect to be suffering from OCD. When you should tell a coworker or a boss, it really depends on the nature of the job and the nature of your relationship with your boss. In certain circumstances, I would say disclosing is not appropriate. In certain cases, I would say to a client, absolutely do tell this. This can help you in that and afford you that extra time or whatever you need to get your work done. It really depends on the setting. When you're in the workplace and you're dealing with an intrusive thoughts, some of the things that you can do for it, if you've worked with somebody and done exposures, this is a great time to do your exposures. One of them could be to purposely go think that thought, turn up the volume of that thought, go to the bathroom and go purposely think it for 5-10 minutes. Turning up the volume can be a great case. Also, going to the worst case scenario. So if you're having an intrusive thought or a worsened thought, what if I kill my coworker? Okay, so what if you do? What object are you going to use on your desk? How are you going to do it? Are you going to do it in the actual office space, or are you going to take them outside? If exposure, or if you haven't done exposure before, I wouldn't do it necessarily uncontrolled, but if you've done these techniques with a therapist, you should have some of these in your back pocket. If that doesn't work, mindfulness techniques can also be quite useful, which is allowing that thought to come in and out, allowing not trying to control the thinking patterns, letting the intrusive thought just kind of be with you throughout the day and doing your best to kind of do your work with the presence of that thought there. If you were to take an SSRI, could that mess with your performance? It could. SSRIs do have side effects. Some of them make people tired. Some of them make people a little jittery the first couple days. It could have some slight bearing on performance, but again, SSRIs don't change who you are. They don't change your experience of yourself. The goal of the SSRI is to turn down the volume of the anxiety. So if anything, other than some mild side effects, one should feel over time a reduction in the volume of the anxiety. So it could have some effects in the short term, but it's just getting through those.